Operation Our Town is a pretty special organization. Special not only to Altoona, but special to this community. Operation Our Town takes the community, the law enforcement, and treatment prevention programs and puts them all together in an effort to cut the use of drugs in our communities and to make our streets safer for all of us. That's a pretty special objective to have. And you can do your part. Wouldn't hurt to send a couple dollars in if you have it and keep this ball rolling, because the battle isn't over yet. Today we're going to talk about the danger, the public danger to you and I of drugs. And to start that, we have a terrific guest with us this morning, Trooper Jeff Petucci of the Pennsylvania State Police. Good morning, Trooper Petucci.
Morning.
May I call you Jeff?
Absolutely.
Thank you. Tell me, today we're going to talk about meth for a little bit, because I don't remember hearing about meth is that a relatively new drug?
No, it's not a relatively new drug. It's been around for a long time. Started in the western part of the United States and then worked its way east.
Okay, but tell me, I see these things about meth labs, okay? What is a meth lab? What's it consist of?
It basically consists of apparatus along with chemicals needed to produce the drug itself. So depending on what type of lab it is, it could be a big lab or it could be a smaller type lab, depending on how much product is being produced.
If I walked into a room, how would I recognize? Would there be like those round pipes you see in stills or things, or what would be in there?
It could possibly be that, but I think what generally in our area, what you're going to see is some glassware, any type of rubber tubing that's coming out of a piece of glassware, or even like a soda bottle, along with general household items such as brake fluid, lighter fluid, batteries.
Brake fluid.
Brake fluid.
And this is what people put in their system.
Well, it's part of the process of making and producing methamphetamine. There's a process that it goes through as far as the extraction, the synthesis of the product, and then also the conversion into methamphetamine. And general household items that you can go out and purchase at a lot of stores is used in making methamphetamine.
Wow. What's its attraction?
Well, it's a highly addictive stimulant that affects the central nervous system. So it has that sense of euphoria. It has that good feeling, pleasurable feeling when someone takes the drug.
Is it addictive like heroin? I think you said highly addictive.
It's highly addictive, yes.
Wow. And so what would cause somebody to want to start on that?
Well, just like anything else, I think a lot of these users will start with the gateway drugs, the marijuana, and then they'll generally graduate, if you will, to a drug like methamphetamine to get a stronger high, if you want to say that. That's probably
so they just keep moving up the ladder.
Exactly.
Not satisfied with this level, they got to go to the next level.
Absolutely.
Do you actually go out and bust these meth labs?
I don't personally know. We have specially trained troopers that can go out to a methamphetamine lab once we know it is a lab. We have a clandestine lab response team out of Harrisburg. So if we come upon a methamphetamine lab in any of our counties in Pennsylvania, we can call our clan lab response team, and they'll come in and dismantle the lab the proper way, because it's hazardous material.
They said it can blow up. It's dangerous. I mean, if you watch the TV shows, this stuff is like dynamite.
It is. And like I mentioned before, these chemicals that are being mixed together, if they're not mixed correctly or if they're overheated, because there's a heat source needed to make methamphetamine. So when you're dealing with heat, you're dealing with these chemicals. It can be highly explosive and can cause fire. And not only to the structure that you're producing it in. Say, for example, if you're in a house or even like maybe an apartment, not just that house and apartment is being affected, you're affecting the other houses in that area and the other apartments within the complex. that's the dangerous part of it.
Oh my goodness, that's terrible. If you're using meth, what are the side effects? All drugs have some side effects.
Yes, there's short-term side effects, long-term side effects. Someone that's using methamphetamine, as far as the short-term side effects, you're going to have an increased heart rate. You're going to have increased blood pressure. You're going to have a sense of confidence, alertness. You're not wanting to sleep. And then as far as the elevated temperature in the body as well, that's some of the short-term effects. Now, long-term effects, someone that uses methamphetamine on a regular basis, they're going to be, or you're going to see significant weight loss in the person. You're going to see dental problems as far as tooth decay. You're going to see someone that's delusional, have hallucinations. And ultimately, the methamphetamine affects the blood vessels in the brain, which could cause stroke and ultimately could cause death.
I heard the term tooth decay used before on our shows, and I'm out in restaurants or I'm out in the public sometimes at the mall, whatever, and I see somebody in their 20s or 30s or whatever, and they appear to have like 3 or 4, or their teeth are kind of, and I'm going to tell you the truth, that's the first thing that comes to my mind is this person's on drugs.
I mean, it is a long-term effect. Now, that may not necessarily be the only thing, but if you have some other signs that you see somebody like that, maybe they have significant weight loss, or maybe they're talking to themselves, thinking that there's someone talking to them.
I could lose weight if I took this.
Oh, yes.
No, I'm just kidding. But that's got to be. But they just don't seem to care.
No, they don't. Someone that's on methamphetamine, they don't care. All they're fixated on is getting that methamphetamine into their system.
This wouldn't be the first drug somebody would take, would it? They would kind of build up to it.
I mean, it could, but most likely they're gonna start off with, like I mentioned before, a gateway drug, and then graduate to something like methamphetamine.
Have we had? I think I remember reading about meth labs that are being busted in our geographic area.
Yes, we've had meth laboratories in our geographical area here in central Pennsylvania. One of the new forms of making methamphetamine is called a one-pot system, or a shake and bake system, where you only need a soda can to produce it. We have found those type of labs, and we call them labs, even though it may be a soda can or 2 soda cans in a general vicinity. That is technically a methamphetamine lab, and is very dangerous.
How many people do you think in our area are, as a percentage of total drug users, how many of them are on meth?
I don't think it's a high percentage. There is a percentage of the population out there in our general area that I'm sure is using methamphetamine, but I wouldn't necessarily say a high percentage. I don't know the exact number though.
How does its price compare to other drugs?
Well, it's funny that you actually asked that question, because methamphetamine, about $200 worth of product, or I should say $200 worth of what you need to make it, produces about $2,000 worth of product.
Whoa!
So it can be, I guess, if you want to say lucrative as far as selling it. Because you only need $200 to get $2,000 worth of product. So that may be a reason why some people use it and also sell it.
Is its use pretty general, or does it seem to be in specific areas?
I think it's pretty general. I don't know if it's in any specific area.
I know in some towns they actually have areas that are considered, don't go in this area.
Right.
Are there some areas like that in this general area?
I mean, I think with Operation Our Town and Push Out the Pusher hotline, there are certain areas and certain houses that we know, law enforcement know in general, where this drugs in general are. So there are probably we know certain places where the drugs are.
Jeff, I've talked to some other police officers, and uniformly they have said that they so much appreciated the awareness that Operation Our Town created, particularly in the Push Out the Pusher hotline, that when people see things like that, they call the police and then notify them so at least they can begin surveillance or check things out. Have you had experience with that?
Oh, absolutely, yes. As far as Push Out the Pusher, our drug people that work on drug investigations receive that information from Push Out the Pusher to help us catch those that are using and also selling drugs. So it's a great tool.
There must be some real tragedies involved. I see the newspaper family, arresting the head of the family, arresting the mother and father, and doesn't that have to tear your heart out a little bit?
Yeah, it is sad. Drugs don't discriminate, so it reaches all aspects as far as whether it's all socioeconomic backgrounds.
Right.
So yeah, it's a sad thing to see.
And what caused you to get into law enforcement, Jeff?
I've always had an interest in being a police officer in general in high school. I went to college, and in my senior year in college, I decided to take the state police test, and here I am today.
That's wonderful, and it looks like the career's been good for you.
Absolutely, yes.
You have a family?
I do.
That's wonderful. I'll tell you, it's too often it's easy for us to just see a police car on the highway or see a police officer somewhere and think, well, that's a job. But it's more than a job. It's a life-changing experience.
Yes, it's not for everybody, but it is a life-changing experience with all that's out there and everything that we have to do and encounter. So it's something that you want to have to do.
Both my brothers are retired police officers, and I truly respected what they did for a living. If I were just walking through the mall and I saw somebody acting kind of weird, what would I do? Is Push Out the Pushers the only option I have?
No, I don't think that's the only option. Depending on what type of behavior that person's exhibiting, if you think it rises to the level that it needs attention, then you could certainly contact that local law enforcement that covers whatever area that you're in to maybe check it out.
Okay. Just yesterday, I was driving from my home to another home right after the first football game. And as I traveled down the road, the car in front of me was kind of weaving back and forth, and their brake lights would go on. And I said to my wife, these people are inebriated. At least they might have been under the influence of drugs, but they were inebriated.
Sure.
And if I were to, dial 911 or something and say, is that possible that you can report people like that?
Yeah, absolutely. And again, if you're looking or you're seeing a car in front of you, if they're swerving and more than one time, and you see it, it's something you can call the 911 system, and they'll put you in touch with the proper law enforcement authorities for that area to maybe try and pull that vehicle over if need be.
Jeff, it's been great talking to you. We're going to stay tuned, folks, for the rest of the program because we've got a couple great guests coming up. Thank you.
Thank you.
Overlooking the city of Altoona, the Booker T. Washington Park had lost its luster. With that in mind, Operation Our Town and the Central Blair Recreation and Park Commission, in collaboration with the NAACP, set out to give back to the community.
The court was in bad shape. It needed some new backboards, rims. There was cracks. There was grass growing up onto the court itself.
New additions to the park will include a renovated basketball court, playground for families and friends, fitness stations, and a walking path.
I can't wait till everything is done so I can bring my grandkids to play in the playground.
Kids can use it for whatever their imagination brings them.
Members of the community already have noticed a difference.
Stuff for the kids to do to keep them out of trouble.
Our next guest is Greg Drew, who's the president of Value Drug Company. Greg, welcome to the show.
Thank you. Pleasure to be here.
Tell me about the Value Drug Company.
Sure. Value Drug Company is a pharmaceutical distributor. We service over 600 pharmacies in a 7-state area, primarily in Pennsylvania, all independent community pharmacies. So your Joe's Pharmacy on the corner is likely being served by Value Drug today.
And this is Altoona-based?
This is Altoona-based. At the moment, we're right off Plank Road, and we're soon moving to a new distribution facility across town in Duncansville.
You know, I hope everybody appreciates the involvement of our local businesses and into this fight and the battle against illicit and illegal drugs. And Greg, you've got to be at the forefront of this as a distributor of those kind of drugs.
Exactly. We have an obligation, both under the Controlled Substances Act and then as a good community corporate partner, to do what we can to help reduce the opportunity for prescription drug abuse in the community.
We hear a lot about prescription drug abuse. There was an article in the paper several weeks ago regarding a young man who hit his mother with a hammer and put her in the hospital because she wouldn't give him the pills or something. That's just beyond my belief. But I guess you see these kind of stories all the time.
Unfortunately, more than I would care to. I chair the Pharmacy Roundtable for Operation Our Town.
Okay.
And we have several folks from the drug abuse support community there who often share stories like that. And we do our best to communicate that to the pharmacists in the community so that they better understand what the end result is of prescription drug diversion and abuse.
That's an interesting subject. Let's talk a minute about the Drug Abuse Roundtable.
Sure.
The roundtables are like committees that set up under Operation Our Town to deal with specific areas.
Exactly.
Law enforcement, treatment, prevention. And tell us a little bit about the drug, your roundtable.
Sure. It's a great little roundtable. It's made up by primarily pharmacists, but also, again, representatives from the drug abuse community, from local politicians' offices that are concerned about the problem we have in the area of Blair County, as well as law enforcement presence to kind of help us put everything in perspective.
And even with all this going on, is drug abuse on the rise?
You know, the Drug Enforcement Administration calls prescription drug abuse the #1 drug problem in America. The Center for Disease Control's said that 2 years ago, over 16 million Americans misused a prescription drug medication for something other than an appropriate medical use.
Excuse me, I hope everybody heard that. 16 million.
16 million. More importantly, 3 people die from an overdose every hour.
Oh my, that's unbelievable.
It sure is. And, you know, there's many problems, I think, that have driven us here. One, unfortunately and fortunately, is a tremendous effort on the part of law enforcement to really corral, to the extent they can, illicit drugs. So I heard you earlier talking to Trooper Jim about meth. And so meth, heroin, marijuana, speed, whatever the illicit drugs in the community, the law enforcement's done a real good job, which has actually, frankly, driven a lot of folks to prescription drug abuse because they finally realized that they were available in the community.
And probably initially, at least, less of a penalty than maybe one of the more harsher drugs?
Probably, because in most cases it's not a trafficking situation. Actually, the DEA said that over 37% of the misuse of prescription drug medications is just within friend and family with no cash being transmitted, which is scary.
Wow. You've got a lot of background in this.
Well, it's something that we care about deeply, and we want to try to be part of the solution. The Johns Hopkins University did a study, and between 2000 and 2010, opiate prescriptions, which are amongst the most abused, doubled in that period of time, following a pain episode with a physician, which means that over the last decade, physicians have been much more likely to prescribe, prescription opiates, which means there's going to be a lot more out into the
and I guess patients get a little smarter about symptoms and what to say to get what they want?
They do, and also the medical community has had a bit of a transformation over the last decade. In the old days, it was a very locked down area. Then there was a period of enlightenment, we'll call it, where the pain practices were starting to be recognized, and it seemed to be the right thing to be able to prescribe medications as freely as necessary to control pain. Unfortunately, one of the outcomes of that has been, the problem we have with prescription drug diversion and abuse today. And I think everyone is waking up to that. The American Academy of Physicians recently recognized and went on record that the entire medical system needs to pay more attention to the use of these drugs, and pharmacy plays a big role in that.
Greg, I used to think about this as like 19, 20-year-olds, but as I read the newspaper, I see ages in the 40s and 50s and 60s with pill abuse.
It's across the continuum. If you were to look at that 16 million folk number, that's about 5% of the population. Actually, in teens, it's becoming alarming. The rate of rise. I think it was the Michigan Health System in 2010 did a survey of all teens that came into the emergency room for any reason. Could have been for a broken foot. Could have been for the flu.
Sure.
Over 10% of those teens had misused a prescription painkiller in the prior year. Which is double the average.
If I were a parent and I had just had surgery and the doctor had prescribed pain medication for me, and I came home and I had the pain medication with me, how would I protect my son or daughter against the availability of my pain medicine?
The way I like to explain it to parents is I would use the same diligence with that vial of medication as I would with anything else I want to keep away from my children. So whether it's a personal matter or it's money or it's anything that they would be concerned with putting temptation in a child's way, then they should put it out of the way, perhaps in a drawer in a locked bedroom, locked medicine cabinet.
You mentioned the medical community attempting to address this. Do you know anything specific that they're doing?
Sure, at least from the pharmacy side of the equation.
Sure.
And I don't want to discount the physician groups, because they certainly recognize the problem in the community. They try to balance it with patients in pain. One of the unfortunate things about prescription narcotic abuse is there are a lot of patients in pain that need to be treated, and sometimes they ended up being limited in their access to those drugs because of the controls we have to put on for illicit use. So that's a real balancing game that I think everyone's learning how to do better. We spend a great deal of time educating pharmacists that we work with on, for example, the Drug Enforcement Administration has a list of 10 common prescribing scenarios under which a pharmacist should suspect that perhaps drug diversion is going on. So we educate them on that, and we also explain to them that under the Controlled Substances Act, and they have a registration associated with that act, that they have a responsibility to not just verify that the prescription was legitimately written, but they actually have to establish that that prescription is for a legitimate medical purpose. So that will mean interaction with the physicians as well as interviews with the patients.
Greg, Operation Our Town is all about the public, protecting the public,
Sure.
educating the public, getting the public awareness. And I will tell you that when I go into a drugstore now, all the news about robberies of drugstores and this and that, not only do I look around, but I kind of feel sorry for the poor pharmacists back there, particularly in the little communities where you may not have these are people that serve their communities because they love their communities and they don't have the elaborate protection. Am I wrong in thinking that?
No, there's recently been a significant uptick in robberies, especially armed robberies, which is even scarier. It's one thing if somebody's breaking through the window in the middle of the night. It's another thing if a pharmacist and their staff or experienced, a gun, between their eyes. We had one of our pharmacies recently outside of Baltimore, Maryland, where two armed gentlemen came in at the time they were closing and walked the pharmacist around with a gun to her head and locked the staff into a room and threatened them with their life. It's very dangerous today to be a community pharmacist.
Oh my! And not only, but customer. That's what worries me. I'm in the pharmacy, and I was in the banking business, and I remember one time somebody had the bright idea of putting bulletproof glass in front of the tellers, and business fell off. And the reason business fell off was because the customers didn't feel safe. You might feel safe, but I'm out here with the guy with the gun.
All by myself, yeah.
And here we go in these pharmacies, and there is no bulletproof glass, and there's just a smile and a welcome, and like I said, and your neighbor behind the counter waiting on you.
Unfortunately, in the inner city now, in Philadelphia and Pittsburgh, even in central Pennsylvania, to some extent, we're actually seeing bulletproof glass protecting the pharmacy staff, and that's terrible because it's a real barrier to great patient care that the pharmacist can otherwise give.
Craig, if you could give our audience an idea, how can we as grandparents and parents and protect ourselves with? I'd be guilty of having drugs just sitting around, and how do we kind of guard ourselves against the grandchildren and whatever, and what would I do in my home to kind of protect myself from that kind of thing?
I think, you make a good point, and I'll go back to my statement a little bit earlier about treating a prescription medication as anything else that you'd want to keep with the children, even to the extent of considering a loaded gun. So wherever you wouldn't leave a loaded gun, don't leave prescription drugs. We also support, as Operation Our Town, DEA's Drug Take Back Day, where law enforcement will be at several locations a couple of times a year, where once you're done with your medication and there's no use for it anymore, you're able to take it in there and it's disposed of properly by law enforcement personnel.
I always think that if somebody broke into my house and stole my drugs, they'd be easy to find because they would faint from low blood pressure before they got out of the garage. You take the low blood pressure pills, and if they thought they were painkillers, they'd be in for a big surprise.
Unfortunately, these folks are pretty smart these days. They know exactly what they're looking for.
I understand that. It's sad. We worry about our young people being educated, but they're getting educated in the wrong things.
Absolutely.
And tell me, when we were talking about physicians, I'm going to tell you the truth. I feel very sorry for physicians sometimes because these lawsuits are so bad. My doctor told me one time that if a patient came in complaining of something, and he didn't, even though he knew they were lying, if he didn't treat it, and then something did happen, he's subject to a lawsuit.
Yeah, and pain is a very hard thing for physicians to assess.
To diagnose.
It is almost always based on the patient's information, which obviously can be changed pretty regularly. Most physicians that deal with chronic pain on a regular basis, so anesthesiologists, spine specialists, oncologists, rely a lot on diagnostic tests that we've recently got available, like significantly enhanced MRIs, which allow them to look at a disease process.
Now, does Value Drug have like educational programs that they present to the druggists and the pharmacies to protect themselves?
We do. We provide them regular documentation on the risks and their obligations. We also share with them news articles or federal postings that they may not be aware of. And recently we've actually added presentations by law enforcement personnel at our trade shows and get-togethers.
That's terrific. Now, isn't there some kind of a communications? I thought I heard somewhere rumblings of if I went to this drugstore and got turned down for, I'm just going to say Oxycontin because I don't know what I'm talking about, and then I went to another drugstore, that they would they know that?
Some of that is just communication within the community. So there, for example, Operation Our Town established a phone communication link a few years back about robberies or turned down prescriptions. One of the things that we believe in the pharmacy community and the prescribing community will lead to significantly reduced use of prescription or overuse of prescription narcotics. The new prescription drug monitoring plans. Pennsylvania is getting ready to approve a program whereas the prescription medications that are filled within a pharmacy immediately become available to other pharmacists and to prescribers, so we can look at folks that are doctor shopping and pharmacy shopping.
Greg, I'm impressed by your grasp and knowledge of the community, and I'm equally impressed with your position with Value Drug because it's such a valuable asset to our community. Thank you very much. It's been a pleasure talking to you.
Thanks for having me.
Thank you.
Operation Our Town is reaching out into our community every day, helping groups like the Gloria Gates Foundation. They received a grant in 2009 from Operation Our Town to help fund their program, which was established more than 10 years ago.
We now have children who've gone through our program and are out of high school, and they're young adults. And they're coming back and telling us the impact our after-school program had on them. So we know that we are reaching the kids.
The Gloria Gates Foundation prides itself on teaching the children lessons that will stay with them throughout their life.
When things get better in their life and they look back, then sometimes we can remember and say, I remember what you tried to teach me, thank you.
Operation Our Town, creating community-minded citizens for a better tomorrow.
My guest now is Jim Walstrom from the Pennsylvania Office of the Attorney General. Jim, welcome.
Thank you.
You look like the Attorney General. You're a good-looking guy.
Thank you very much.
Tell me, what's your job with the Office of the Attorney General, Jim?
I'm a supervisory narcotics agent. I supervise agents in 14 counties in the central part of the state, which Blair County is one of those.
Right.
So we encompass Blair County and Altoona.
That's a big responsibility.
It's a huge geographic area. It's actually the largest geographic region in the Attorney General's office. We go from from Blair and Cambria counties the whole way to north to the New York state line.
We talked to Trooper Petucci about meth, and then we talked to Greg about the prescription drugs. But you see it all.
Correct.
You see every kind. Can you see the rise and fall of certain classes of drugs in various times, or is it just steady increase? Or tell me how you evaluate whether we're winning or losing.
It does ebb and flow, and we see it a lot by our enforcement tactics. If we're enforcing heavy on the heroin side, where we start to cut that off, we'll see those opiate users roll over to prescription drugs. And vice versa. As we're putting more focus on prescription drugs, you'll see those people roll over into heroin. As one drug becomes harder to get, people who are addicted will find another way or another drug to move to.
If I had to make a list of all the drugs that were available out there, I guess we would start with marijuana.
Correct.
And then go up the trail to heroin, meth. What else is out there?
Well, the drug, the chart as you termed it, illegal street drugs and drugs that are illegally diverted, which are prescription drugs. They're legal drugs in a sense that they're legal if you get a prescription for them.
Right.
But if you illegally divert that, or you illegally obtain that then becomes an illegal substance. So as you go through all those drugs, you have marijuana, cocaine, crack, heroin, methamphetamine, and then you start going into the synthetic drugs of ecstasies and the blizzards and the synthetic marijuanas and all those drugs.
If I was a drug addict, I wouldn't know how to order from the drugstore.
Correct, but those individuals know.
They
Correct.
know.
Correct.
And I guess they travel in circles where they're constantly educating each other.
And the internet is a huge educational tool. You can go on and Google anything you want. You can go on Google how do I make methamphetamine, and they'll walk you through it.
Oh,
how do I get synthetic drugs? Where can I find Blizzard? Those types of things. It's all there.
Jim, in the next segment, we're going to talk a little bit about Colorado and what effects that might have in the long range. But let's talk about Blair County right now. What do you see happening in Blair County?
Blair County is at this particular time is in a status of a lot of heroin use. We're also in a status of individuals that we arrested and put in state prison 10 years ago are now coming back to this area. They weren't from here originally. They came here to deal drugs. They were arrested here. They went to jail for 5 or 10 years. Now they're coming back. So we're seeing that type of thing. We're seeing a significant use in synthetic drugs. Drugs that you can obtain on the internet, have them shipped right to your house. Drugs that are illegal in the state of Pennsylvania since 2011. Prior to that, those synthetic substances were not illegal. Post-2011, they are illegal, but if you go on the internet and you go to one of these individuals in North Carolina or Maryland that will ship them to you, they will tell you that this substance they're selling is not illegal, because what they attempt to do is they alter that chemical makeup just enough to try to get around that law.
Just a little bit.
Right.
I'll tell you, it's got to keep you guessing. How did this? I remember when Operation Our Town got started, there was kind of a panic in the community. All of a sudden, drugs were on the front page every day. Incidentally, today there were no drugs on the front page. That's like a victory for me.
Right.
Did the good guys win sometimes?
When Operation Our Town started, it was twofold. It was drugs and drug-related violence that was going on. There were shootings almost daily, shots fired, shootouts on the street, people shooting each other, shooting into houses. There was a lot of things going on there that piqued everyone's interest from the standpoint of it wasn't just people being arrested for drugs. There was a lot of violence surrounding these individuals. We got a handle on that. We put a lot of effort and a lot of resources into those individuals, investigating, putting them in jail, and we put a lot of people in jail. But it's the issue is still the same. We can arrest every dealer that comes into this area, and we're not going to stop what's going on, because as long as you have people, as long as you have the demand, there will always be the supply. So as long as you have people that are willing to buy it, or people that are addicted to it, or people that need it, there will always be a demand coming into this area, no matter what happens. No matter how we could put a big fence up around Blair County, and it's still going to happen.
Now, I see these clinics, methadone clinics.
Yes.
These clinics, parking lots are jammed.
Yes.
Does that do any good?
Yes, the rehabilitation segment of Operation Our Town, part of that rehabilitation is the methadone or the counseling and the methadone. The methadone is a weaning off substance that basically allows you to function and not use heroin, but you're still using a drug. So when you move from the heroin to the methadone, the proper process, and I don't know scientifically because I'm not a counselor or a doctor, but the proper process would be then to wean that substance down till you're completely off of that. It's sort of a lifeline, so to speak, to take you from a heroin addiction to no addiction.
Well, thank you. I've always wondered about that, because I see, sometimes it seems like I see the same names in the paper, and sometimes I see the cars in the parking lots, and I think, do we ever win? But it sounds like we are winning.
There are some success stories. There certainly are, but there's also unfortunately, like anything else, you generally hear about the unsuccessful ones, because those are the ones that make the news.
We talked about the dangers of meth, and Trooper Petucci mentioned the loss of your dental facilities. Are there other drugs that cause that?
Sure. The synthetic drugs. The bath salts they're termed bath salts. They're not really bath salts. They're just sold as a bath salt. They're not water soluble.
They're bath salt, but they're not water
soluble. They cost about $100 a gram. So if you actually use it as a bath salt, it would be about a $2,000 bath. So no one's really going to do that. That drug will do the same thing. It will affect a lot of different parts of your body. They generally inject it like heroin, so you will see those injection ports on their arms. It will affect their teeth, enormous losses of weight. We'll see people drop 45 pounds in 30 days, and you really don't. you really don't care about doing anything else. When you're doing that synthetic drug, your urge to redose happens in about 45 to 120 minutes from the time you use it. Unlike other drugs where it's hours and sometimes days, you can't be a casual bath salt user. That it just doesn't happen that way. Just like you can't be a casual heroin user. You can't say, well, I'm a recreational heroin user. Like somebody may smoke pot on the weekend. It doesn't happen that way with synthetic drugs or heroin. The downside of the synthetic drugs versus all the other drugs, the worst part of the synthetic drugs are the side effects of this. Severe chest pains, heart attack, paranoid delusions, hallucinations, to the point where those hallucinations can happen immediately or they can happen months after you stop using the drug. And we're just finding that out now, that these hallucinations can reoccur 4, 5, 6 months down the road, because this is a fairly new substance. And now we're seeing these people that are in rehab centers, 6 months later they're not using. They go through these episodes where they go into these paranoid delusions and hallucinations. They try to commit suicide. They try to hurt other people. This is a substance that's not FDA approved. It's not a pill that everyone knows what the chemical makeup is. This is something that's probably being put together in somebody's basement by an individual who couldn't pass 8th grade chemistry. But you're buying this and you're shooting it into your veins.
Jim, I know exactly what you're talking about, and I very seldom do, but 30 years ago, I used to take amphetamines for weight loss, okay? And I started out and worked my way up to what they called speckled eggs. And I got a lot of work done. They were terrific.
Right.
And one day, I went to the doctor's office and I said, do these pills have any side effects? And he said, what do you mean? And I said, sometimes I'm sitting in a room and I wish I was on the other side, and I am. And he said, how many of those pills do you have left? And I pulled a bag out of my pocket and he went, boop, that's it, you're done. Well, I later read some articles that these things would build up a plaque in your brain, and then that plaque would break loose whenever. Right. And it would be like an overdose of this stuff. And it was a little scary.
Right.
I thought to myself, wow, I'm lucky.
Right. Correct.
And I just learned another thing from you. I thought bath salts legitimately were like right next to the talcum powder and the...
They are.
They are.
Yes, Epsom salts, bath salts, those things truly are bath salts. This product is being sold and marketed as a bath salt, or jewelry cleaner is another term they're using. Comes in a little packet. There's about a gram in the packet. You're paying about $100 for it on the street.
Wow.
You can buy this on the internet, though, at much cheaper prices and have it shipped right to your door. It is illegal. If you are caught in possession with this substance with the intent to deliver it, or the delivery of it, is a felony charge, just like if you were caught with heroin or methamphetamine or cocaine.
Could you originally buy it in a drugstore?
You could originally buy it in a convenience store. You could walk in. There was when it was legal prior to 2011, a kid 10 years old could walk in and buy it. It was easier to purchase than cigarettes.
Oh my, that's, I guess we should just be on guard all the time about things that are happening. The people around us that you may not even suspect are on drugs or could use drugs.
The drug culture is like individuals who create computer viruses. They are constantly one step ahead of you, so to speak, and they are constantly figuring out new ways to do it. It's like an individual, like someone who's in prison. They have all day to figure out how to get drugs into that prison. So these individuals in this drug culture are constantly figuring out ways to beat law enforcement, which then causes us to constantly figure out ways to not let them beat us.
Haven't heard much about cocaine. Is that still a drug of
It is
for some people.
It is. It is still around. There's just so much heroin and synthetic drugs, and every once in a while methamphetamine comes through. This area, for some reason, enjoys trying new things, and everything that comes down the road hits Blair County for some reason. I did a seminar on synthetic drugs at a gang conference, and I had 4 or 5 narcotics detectives from Virginia Beach. They came up to me afterwards and said, "What are you talking about? Never heard of it. Never even heard of it." We have people jumping off buildings and stabbing themselves and cutting their heads off in Blair County on these drugs, and these guys in Virginia Beach never heard of it.
I think there was a news article in the state college paper about a young college student who jumped off the balcony and he determined that they were on drugs.
Right.
That's scary.
It is.
That's scary. Jim, I'll tell you, do all those drugs have the same effect long term? They just
No, they all have different. They all have different terms of effect. They all have different effects. They affect you differently. Some are more dangerous than others. The same thing with the synthetic marijuana. You used to be able to buy that prior to 2011. Same thing in a convenience store or gas station, and you would smoke it. And what it was a chemical sprayed on an herb that you could light, something that would light. This chemical was sprayed onto it. What we found out is this stuff was so dangerous, it was doing the same things, causing severe hallucinations, paranoid delusions. People were committing suicide. People were doing outrageous things on this substance, and found out that at that point, the legal synthetic form of this marijuana was so much more dangerous than the real marijuana that we had to quickly move and make this stuff illegal as well.
Jim, let's talk a little bit about you. What got you into law enforcement?
Oddly enough, I've always wanted to do this. If you look at my second grade report card on the back, our teacher asked us what we wanted to do, and much to Trooper Petucci's uniform, I wanted to be a state trooper, second grade. And I got into law enforcement right out of college. First worked at the Altoona Police Department, then with the Attorney General's office.
Okay. And are you local in Altoona? Was that your home originally?
No, I was not from Altoona. I came here when I got hired by the Altoona Police Department.
Okay.
Worked with your brother.
And tell me about the progress now. You were state police officer?
No, I was with the Altoona Police Department.
Altoona Police.
And then with the State Attorney General's office.
State Attorney General's office,
yes.
Right from there.
Mm-hmm.
But you've done well. You've done well.
I've been doing it for 30 years, getting near the end of my career at this point.
Really?
Really.
Well, stick around. We need you.
Thank you.
You know, folks, we've been talking about some very interesting things here. And in a minute, we're going to come back with all three of our guests, and we're going to have a really great discussion. Join us in just a minute, please.
Operation Our Town is reaching out to groups in our community every day, helping groups like The Rock. The Rock is a nonprofit organization hosted by the United Methodist Church in Altoona. They received a grant in 2009 from Operation Our Town to help fund their program.
Operation Our Town has been essential to our growth and basically our survival.
The Rock program runs every Wednesday evening and provides a safe, fun environment for school-aged children.
My favorite part about the Rock program is just being here with friends and learning about different things every week.
Children attending the program participate in after-school activities and are fed a warm, home-cooked meal every night. Operation Our Town's goal is to take back our neighborhoods and to create community-minded citizens for a better tomorrow.
Our guest now on my far left is Greg Drew, the president of Value Drug Company. On my near left is Jim Walstrom, the Pennsylvania Office of Attorney General. And on my right, handcuffed to my wrist, is Trooper Jeff Petucci. Welcome back, guys.
Thank you.
Thanks.
We've been talking about drugs in the community and all the things that are happening in our community. Let's talk to you, Greg. Colorado just passed a law legalizing marijuana everywhere, like cigarettes, right? What does that mean to the drugstores and to the community? And do you have any feel for that? I'm asking for your personal opinion, not the political side or anything.
Yeah, and that's probably where I'll have to come from. But as a pharmacist, I'm certainly aware of the issues of gateway medications, and marijuana certainly fits into that category. And I believe, especially the fact that it's been promoted for recreational use as opposed to some other term. I think just sets a spiral that I'm not sure anybody's going to be able to hold on to.
Kind of interesting. It is, in my personal opinion, I'm glad I don't live in Colorado, step one. Step two is, we're going to find out if it's a completely harmless recreational drug. We're going to see what the results are in a community where you just have people doing all kind of things. I want to tell our audience, our two law enforcement officers here, To their credit, when I asked them that same question, they both had the same answer. Our job is to enforce the law, and whatever the law is, that's what we do. And that's very admirable. And I'm sure it sometimes must handcuff you in the performance of your duties. But every show we've had, they've kind of said marijuana was the introductory drug. Marijuana was the introductory drug. And now we hear about all these other drugs in our community. I'm going to ask you, Trooper Petucci, what's your opinion of the area? And are we kind of controlling it? Are we working with it? Or what are you seeing happening out there?
I think as far as the law enforcement side of it, I would hope to think that we're controlling it. But, the drugs are out there. They're accessible. We see that our youth are out there using the drugs, and there's adults out there using the drugs as well. So, but I would like to think that we're controlling it and doing our best to combat it, the best that we can.
No doubt you're doing your best. I mean, I'm really serious. You guys do a terrific job out there, even when they stop me for speeding. But that's another story for another time. Jim, tell me about how does Blair County compare to some of the other surrounding counties?
As we talked earlier, I cover 14 counties, and in those 14 counties, our major areas are Cambria County, which has Johnstown, Blair County, which has Altoona, and Lycoming County, which has Williamsport. Throw in there as well Center County with State College. So the more metropolitan area, if you will, or urban type settings, as urban as you can get in central PA, tend to attract more of that type of activity. Certainly our higher levels of drug activities are in Johnstown, Altoona State College, and Williamsport. Not to say that there's not drugs going on in Tioga County, because there are, and same thing in Potter County. It's just not as prevalent, it's not as consolidated, and there's not as many people involved in that activity.
Greg, I asked you about what Value Drug was doing to educate the pharmacists and the employees to protect themselves and the public and to control this. Are we doing anything in the educational system for students in the school systems?
That's a really good question that I'm probably not prepared to answer. Maybe one of these folks, I know they do a lot of community outreach. We have been more involved with say, in the pharmacy channel and the prescriber channel. Okay. That's not to say we shouldn't be in the schools, but at this point, one of these fellows could probably speak to that better than me.
Jeff, are we doing anything for the state police?
Yes, we are. I mean, the community service office and all our troops throughout the state are out actively engaged in the schools. We have drug awareness programs that we do through the grade schools all the way into high school. So, we're trying to do our part as far as the educational aspect of, why are drugs bad and why you should not be using them.
It's interesting you say that, because we've had guests on this program who said the educational process starts at the grade school level.
It does.
That was shocking to me. That early in life, our young people are exposed to even the possibility of having drugs or doing drugs. And then I heard stories about their parents. The drug sniffing dogs came in, and it would point out a locker, and it turned out that the student wasn't on drugs, but their parents were using drugs, and it got on their clothes because they were at home. Oh boy, that just tears your heart out. Jim, how about you guys? What are you doing?
We have a demand reduction unit out of Harrisburg that actually travels around to all the school districts, does seminars, talks. We do them as well within our own regions. We send agents out to the schools, and we found, as you were saying, that if we wait till they're in high school, those individuals that are involved in drug activity are already involved, and we've already lost them. Every graduating class that comes out of any high school is the most educated individuals about drug abuse ever. Every year they're more and more and more educated. They get more and more exposure to the dangers of drugs. we're the whole way down in 2nd and 3rd grade now starting to talk to kids about drug abuse. So every year that 12th grade class graduates, they're the most educated class ever on drug abuse. Next year they'll be more educated. The year after that they'll be more educated. So we're trying to hit them young. We're trying to catch them, because if we go into a senior class and talk to them about drug abuse, I can tell you, I can go to any school and there'll be 3 or 4 people sitting there saying, you're full of crap, you don't know what you're talking about. I can do whatever I want. I can smoke pot on weekends, I can do coke, I can shoot heroin, I can do whatever, and I'll be fine. And then there's a couple individuals that are high while I'm talking to them. So
is that right?
There's those things. I had an individual pass out in front of me, a kid pass out in front of me while I was standing in front of him with a drug detection dog doing a talk one day. Overdosed and dropped out of the chair. So that's why we need to start back at 2nd, 3rd, and 4th grade, hit those kids young before they get to 9th, 10th grade, because at that point, if they're going to be involved, they're already involved.
They have passed a law about, and I don't know the specifics, that you're not allowed to sell or distribute drugs within so close to a school.
1,000 feet.
How does that work?
It's 1,000 feet of a school or a park or anywhere where there's children involved, daycares, that type of thing.
If you sell drugs within 1,000 feet, it's additional penalties?
It's enhanced penalties, yes.
I'll tell you, another thing that I think about is people my age, we find it incredulous when you tell a story like that about somebody falling. I mean, it just defies our imagination that this country has reached that level, and so we're kind of naive when the grandchildren steal the drugs or whatever. Or is there anything happening? I know the buyback or the take back the drug program, but what else is happening out there for the general public? Anything? Any of it?
Well, as far as
just the general population, particularly the older population, like senior citizen centers and things like that. Do we talk about the prescription drug abuse?
As far as the senior centers, I would probably gain to say no. Now,
we all fall asleep after the first paragraph.
No, but as far as maybe another part of that question, the drop-off sites, through the Drug Enforcement Administration, there have been several throughout the year. I think Greg spoke about that too, but I believe Governor Corbett just came out with a new initiative where there are drop-off sites throughout the state of Pennsylvania now. So if there are seniors out there that have drugs, they can go to drop-off sites at any point during the week and drop those unwanted drugs into those facilities.
Anything else?
And those same individuals can call the Pennsylvania State Police, the Attorney General's office, or local police departments if they're looking for advice on what to do with maybe prescription drugs they have, or they want advice about anything concerning drug activity or drug abuse. They can certainly call any of us, and we will attempt to point them in the right direction and help them out with the information they're seeking. And it could be a whole bunch of things. It could be the individual next door they think they're selling drugs to, they have prescription drugs they're not sure what to do with from 3 years ago, and they don't want them in their house because they're afraid someone will break in and steal them. So, they can certainly call any of us. They can call the Push Out to Pusher hotline. Call the Altoona Police Department, any local police departments, Pennsylvania State Police, Attorney General's office, and we'll attempt to get them the information they need.
I hope everybody's listening to this, because we have a team of professionals here who are representative of a wider network of professionals, all with the same purpose in mind: keeping our communities safe and drug-free. Your job is to report any activities that you think is suspicious and not be embarrassed about it. You got to step forward and say, this is my responsibility. This is my town, my house. I'm responsible for it. And it doesn't work without everybody's help. So besides saying thank you to these guys, we need to all do our part, and that's kind of important. Greg, let me ask you a question. If you could change one thing today, what would you think what change do you think would help us best in our fight to protect these young people from this?
I think from the pharmacy community's perspective, that probably the biggest change would be a wholesale awareness on all parts of the legitimate medical community, from a physician prescribing to a pharmacist dispensing to a patient taking the drug, and really understand what the end result is of prescription drug diversion and abuse. In most folks, you mentioned it a little earlier, if you get some folks a little later on in life, they may not be as aware of what the downstream implications are of that when they elect to give a 16 or 18-year-old grandson a half a dozen pills because he got hurt playing football. They may not understand that. I think we could all do a better job in raising that level of awareness. We're also doing a good job working with the law enforcement community and getting databases in place so that all the medical professionals understand what the other ones are doing, so that we don't have 6 physicians prescribing patients that are going to 6 different pharmacies and avoiding cash prescriptions, making people use their insurances so that we can track them. That we can continue to tighten up our part of the bargain, and everybody needs to be a good corporate citizen.
Yeah,
as well.
I guess that's really where it starts, isn't it? Is the prescription, the issuing of the prescription, and if the physicians had like a data bank where they could say, wait a minute, you just got prescriptions yesterday. That would solve a lot of problems.
It would. The entire community needs to understand the importance of securing the pipeline for prescription narcotics. It's laid out very clearly in the Controlled Substances Act, and it runs all the way from the pharmaceutical manufacturer through to the distributor, which is what we do, to the community pharmacy, to the patient. And everybody has a responsibility to keep that chain secure.
Greg, I'll tell you, I come down squarely on the side of we live in an open society. There are no secrets, okay? If you think you've got some secret, you're just fooling yourself. And I agree wholeheartedly with the observation cameras, all the things that go on, whatever the data collection is. I want to know who the bad guys are. I don't care what they know about me. I don't have anything to hide, and if I did, it probably wouldn't be exciting enough for them to act on. But, I'm sorry. The days when you said everything's my business, it isn't. We live in communities now that are together with electronics and instantaneous information, and it's kind of scary. Jim, how about you? What would you, if you had an opportunity to just take a brush and change something, what do you think would be a good thing to have happen?
Well, several, but I will echo off of what Greg was saying about the prescription monitoring program. I think that will be huge for us. We don't have anything like that in Pennsylvania. We have the program we have now. We're only seeing Schedule 2s, and they're 20-30 days after the fact. So really what this program would do, if it passes, and we're trying to get it passed, and the Operation Our Town Pharmacy Roundtable was a huge proponent of getting this pushed in front of the legislature. This will be a real-time database where if someone comes into Greg, he can punch them in and he can see whether they got a prescription at anywhere from any other pharmacist. So that will be big. That will be big for us to go in and look at that. And then if they, and I'm not sure exactly, I know there were some limitations on this, so I may be talking about something that's not there, but I think there was also a leg of this that would allow you as a consumer to go on and see what prescriptions you had gotten in the past. At least that was originally part of this. But just from the standpoint of a pharmacist being able to look in and say, did Jim Walstrom get a prescription for hydrocodone in the last 30 days, and punch my name in and see that I've gotten 3 in the last 3 days, would be a great asset to him to be able to refuse to fill that prescription.
Thank you so much. I apologize. We haven't got to Jeff, and our time's up. So I would invite you to join us for another episode of Taking Back Our Neighborhoods. And I'm going to try to talk Trooper Petucci into taking my handcuffs off now, and we'll see you again next episode.